My name is Lynn Eschenbacher, and I am the National Director of Pharmacy Operations for Ascension. The title of my presentation is Prioritizing Areas for Improvement. I have no financial relationships to disclose with regard to this presentation. Key abbreviation, self-assessment question. Which of the following is not used for scoring for prioritization of implementation? Ease of implementation or easy to learn, permanence of the solution, impact of the solution or effectiveness, cost of the solution, or personal preference. We'll come back to this at the end of the presentation, and we'll do self-assessments there. So let's talk about the prioritization of areas for improvement. In other presentations during this module, you've learned about how to generate a solution. You've learned that there are many errors and system failures and issues that can occur when a medication error happens, and you've developed solutions, but how do you know where to start? You can't do everything at once. There's only so many hours in a day. There's limited resources. We don't have financial support that is endless and have so many monies that are available to assist with this. There's only so many FTEs. There's only so much time. And so you have to decide which of these is going to make the biggest impact on patient care and the most valuable solution. Because at the end of the day, all those great ideas that have been generated from failure mode and effects analysis or root cause analysis, all those great things that you have generated up until this point, if you don't implement them, they will never change the care to the patient, and they will never impact that safety. And so it's so important to make sure that we implement those, and in order to implement those, we need to decide which to do first. So a technique I'd like to teach you about today is called the Solution Prioritization Matrix. And this is a technique that allows some objectiveness, some objective scoring to a very subjective process. So as you're going through the other, lots of people may have good ideas. They're sharing different ideas on your team. And so to give it something objective based on a scoring helps to move through this process. As with some of the other techniques you've learned, utilizing a multidisciplinary team is essential. If you were only to have a team of all nursing or all physicians or all pharmacists or all another discipline, you would only get one idea of thinking and one way to prioritize this. So the more that you have representatives from nursing, pharmacy, physicians, respiratory therapy, environmental services, whoever might have been involved or a part of your solution brainstorming or who may be impacted by the solution being implemented, ensure that they're involved in this process. You might even bring in administration or executive leaders as part of this process as well. But the more that you have a multidisciplinary team, the better this will be. Sometimes it's helpful to have a facilitator. You yourself could facilitate this process, but sometimes it's nice to have an external person help to walk through the scoring. It's helpful to have a note keeper as well, so that if you are facilitating, there is somebody else who's able to write down the numbers and to calculate those as well. One other helpful hint that might be helpful in this process is you might have your team members pre-score this and come prepared to discuss. So in the next slides, I'll go through exactly what I mean by pre-scoring and the matrix and the scoring, but I wanted to give you a helpful hint that might save time during the process. You could have this grid open and go line by line, and when you bring your multidisciplinary team together, talk about each line and not have scores there. But to help improve the timing of the process and speed up the process, you might want to send it out ahead of time, the grid with the solutions and all of the prioritization options, and then have them score that, and then when you come to the session, then folks can read off the scores. One of the things that you want to make sure is that you're not biasing during the scoring process. If one person says a 3 and then everyone thinks, oh, that is probably a 3, then everybody's going to start saying a 3. So if you don't score ahead of time, make sure that you have some kind of a process during the session to make sure that you are reducing the bias. Do people write it on a piece of paper first and then say it out loud? Do you do something called the fist of 5, where you hold up your hand and everybody on the count of 3 shows what number they believe it is? So there's some different ideas and techniques that you can do to reduce the bias. And in the end, if there's a tie on scoring, lean conservative to make sure that we're getting the best results. So I mentioned some scoring, and so let's go into the details of the solution prioritization matrix. So what this is a chart, and what you do is on the left-hand side, you list all the potential solutions, one per line. And then across the top, you have columns with the different items that you're going to score on. And again, in the next slide, I'll show you what this chart looks like, and then in the next slide, we'll go through an example. So one area that you could score on is the ease of implementation, or is it easy to learn? Scores range from 1 being very difficult to learn to 5 being very easy. So is this something where you're teaching people how to program an intravenous smart pump? Is this where you're just handing out a handout and they read half of a page? Are they learning to sit down at a computer and do order entry or prescribing or administration or different types of things? So think about how easy or how difficult it would be to learn this new solution. The next topic is the permanence of the solution. Is this something that you just came up with quickly after the error happened and you wanted to make sure something got in place quickly? Is it maybe more temporary? Or is it maybe something that's more permanent? And so you can score based from 1 for temporary, 5 for permanent. Another area to score on would be the impact of the solution or the effectiveness. How much is this going to reduce the harm, make a difference, make it safer? 1 for a low impact, 5 for a high impact. Things that you consider in this one are what Dr. Wade has taught you in other presentations. Let's think about those fail-safes. Think about those forcing functions. Automation, standardization, redundancies. Another area that I like to think of as well are the mistake-proofing techniques. The first mistake-proofing technique that would be a 5 or the highest impact is elimination. If you can eliminate selections, eliminate choices, that reduces the chance of repeating that error. So an example of this, the example of this would be with a patient-controlled analgesia. If you had 5 different concentrations of morphine PCAs, you maybe had a 1 milligram per ml, a 10 milligram per ml, a 50 milligram per ml. If you had all these different concentrations, there are so many errors that could happen. The wrong one could be prescribed, the wrong one could be put in the automated dispensing cabinet, the wrong one could be programmed in a smart pump. And so if you eliminated all those concentrations and you only had a morphine 1 milligram per ml, and that is the only one that your health system used, then you would reduce the chance of all those different places to have a medication error. So again, that's your strongest technique. The next one is replacement. Replacement is replacing with automation or technology, or replacing something that you believe would make it safer. So for example, using an intravenous smart pump versus just hanging the bag and using a drip chamber. And so if you had a smart pump where you were able to program in and there were guardrails or safety checks associated with that, that's very different than just hanging a bag to straight gravity or, like I said, a drip chamber. The next one is facilitation. And facilitation is something like a checklist to make sure you've done all the things that you need to do to be safe. So these first 3 mistake-proofing techniques occur before the error might happen to help reduce the chance of an error. The last 2 would occur potentially after an error had happened, but they would minimize the impact or the effect. So detection might be something as checking blood sugars after you have given insulin to ensure that the patient is not hypoglycemic. And so how often you check those that would be a technique, a detection technique. A mitigation technique that would relate to that would be making sure you have a hypoglycemic protocol such that if you did detect that the patient was low blood sugar, you have a way to mitigate that. So think through those, elimination to mitigation. Elimination is your highest impact, mitigation is your lowest impact. Also education, we talk about education is needed to help convey the message and teach, but education alone is not, would be more of a 1 for the impact of a solution if all your solution was education. And the last one that you can score on is the cost of the solution. 1 for a high cost and 5 for a low cost. And so you would be able to see, does this cost $1 million, does this cost $10, and score based on that. So here's what the chart would look like. You can see across the top, it says potential solutions, and in that first column you go down and see solution 1, 2, and 3. You would put the names of the solutions that you've generated in those. You can see across the top the ease of implementation to the cost of the solution, all the topics that I just described, and then there's a final column for total score. What you would do is, again, you can either send this out as a chart to your team members, have them pre-score it and come and talk through it. Say, okay, what did everyone get for ease of implementation in solution 1? And some people say 2 and some people say 3, and then we average all those numbers together and decide what number you use for that column. And so then go through it all. Or again, you can just have people during the session come up with the numbers, but make sure that there is a way that you're not biased in those discussions. So then what would happen is you multiply across ease of implementation times the permanence times the impact for that solution 1 across the entire row, and you come up with a total score. At the end, you'll compare the total scores to see which solution appears to be the best. The highest score indicates a more valuable solution. So the higher the score, the better, or probably the one you'd want to prioritize first. So again, here's an actual sample prioritization filled out. I mentioned earlier elimination technique for only 1 standard patient-controlled analgesia concentration. And PCA, again, is where the patient is pressing the button to receive a narcotic, and so the patient is in control of that analgesia. So for example, the ease of implementation might be a 3 in this situation because you might have to work with all the physicians and you might have to get consensus and prescribers on which one of those concentrations might you use. Then you might have to work on buying new concentrations, stocking them in the automated dispensing cabinets. So it's not the easiest, but it's also not the hardest. The permanence, we talked about that. This would be a permanent solution, reducing and eliminating those concentrations. The impact, we talked about elimination being one of the stronger. Some people might argue that this is a 4, maybe for the impact, or a 5. But you'd want to make sure that there would be a process that no new concentrations could be introduced. So it could be a 5 as long as you have a strong process to make sure that no one buys a 10 milligram per ml or a 50 milligram per ml and introduces it into the system. The cost of the solution, maybe it's a 4 because maybe it costs a little more to buy the concentration you selected than the other. But again, you and your multidisciplinary team can work through that, and then you multiply across. Another solution, so again, this might have been a med error where a patient had respiratory distress related to using a PCA, or there was a med error related to PCA, and these were 3 solutions that your team brainstormed. So maybe another solution that your team brainstormed was that only the patient can press the button, not a nurse, not a physician, not a family member pressing the button. And so then again, you can go across the scoring. How easy is it to do this? What's the permanence? What's the impact? And you can see that this one scored 180. And then the last one, capnography, that's that end-tidal CO2. And so maybe if you were to implement that and introduce that to your health system, that if you look across, the permanence would be pretty high because you implemented it. Now the impact I put as a 4 because what if a patient pulls it off their face or isn't 100% compliant, so it's not always 100% there. Probably costs a little bit to do that, but is pretty strong solution to be able to detect it. However, you can see it scored a lower score doesn't mean that it isn't a great solution. It just means that you may prioritize this to later because you may want to do another solution that's easier to implement, costs less, and has a high value. So in this situation, we may prioritize standardizing to one PCA concentration, then addressing only the patient pressing the PCA, and at the same time you could be working on the capnography, but that may not be the first solution that you implement. So just some additional practice tips now that we've gone through the solution prioritization matrix. It's possible for you to create your own scoring or your own criteria for scoring. So we use things such as the permanence of the solution, the ease to implement, the education on it. So if for some reason you're looking at something that would impact customer satisfaction, or maybe you wanted to maximize the current technology you have, those column headers across the top, you could change those based on what you're trying to implement. But work with your team, make sure your whole team's in agreement, and also make sure they're objective and they're not subjective. Is it pretty, or do you think we'll like this? Things like that wouldn't make for a very good solution prioritization matrix. Another thing you can do, when we just did the one on the previous slide, they were all weighted equally. There was not one that we gave a greater value to. Something else you could do is weight the criteria if you wanted. So one of them could be 0.85. Another one could be 0.15, or you could do 0.5 and 0.25 and 0.25. Just make sure that you equal up to 100%. But you could weight those if you wanted to give something a higher value. It was more important to your organization than the others. Use the scoring, but also use your multidisciplinary team to confirm the prioritization. Use your expertise. So what if the top one came out as 300 and maybe the next closest came as 50? Well, and then another one came at 190. Well, maybe that 190 from the expertise of the group, you say, gosh, that really does have a lot of value. So think about that. The scoring is great. It gives it some objectiveness to it, but you are the experts, and if by chance there's something that needs to be changed in order of solution implementation, please work with your multidisciplinary team to look at that. So the scoring is a great guide, and you could use it, but also use the expertise of your team, and you may switch the order of your solution implementation. In additional modules in this, or additional presentations in this module, I will go through the steps on how to ensure a successful implementation. So what I've talked about today is, once you've done the great work of identifying the solutions, how do you even know where to start? What's a technique so that you know which solution to start with? Just a few additional considerations that are part of that solution prioritization matrix. Some of the medication errors have similar processes, similar root causes, but if failure occurs, they're more likely to cause significant patient harm. So what I want you to think about is you may prioritize a solution in an area with a high alert medication, such as a chemotherapeutic agent, insulin, narcotics, or narrow therapeutic agents such as an anticonvulsant, or high-risk patient populations, those neonatal patients, pediatrics, geriatrics. You may prioritize solutions higher in these areas. So just looking at a Milk of Mag or a Docusate, or some medications that may not fit into these high-risk classifications. You may want to focus on these high-risk areas for solutions before you address some of the others. They may all have similar root causes, similar system failures, but you may want to focus on these because if an error or an event happened associated with these, the harm to the patient could be much more significant, and we're here to protect our patients the most we can and make a difference. So back to the self-assessment question. Which of the following is not used for scoring for prioritization of implementation? Ease of implementation or easy to learn, permanence of the solution, impact of the solution or the effectiveness, cost of the solution, or personal preference? The answer is E, personal preference. So in conclusion, Prioritization of solutions is needed to ensure the most valuable, the top solutions are implemented first. We only have so many hours in the day, so many resources, and we want to use those the best we can to make a difference to our patients. The solution prioritization matrix provides an objective method to identify those valuable, those top solutions. Here are the references that were used in preparation of this presentation. Thank you for your time and participation.